Good evening. We're going to call the meeting to order here. This is June the 4th, so if you're looking for the County Board Commission meeting, you found us. We're going to stand at this time and have an invocation, Pledge of Allegiance.
Dear Father, fill our lives with your peace and prosperity. In your name we pray. Amen. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. At this time, I need a motion to approve the minutes for the May 21st, 2013 meeting, as well as we have the resolution for the proclamation.
Motion to approve.
Have a motion. Is there a second?
Second.
It's been motioned and seconded. Any discussion?
Commissioner, that does not include the consent agenda tonight, correct?
Correct. That does not.
All right. Thank you.
All those in favor signify by saying aye.
Aye.
Aye. Motion carried. With that, we're going to turn to our presentation portion of the meeting. And we have presentation by our very own Mr. Doug Anderson, who's sitting lively in the audience. You look like you're about to be fully retired. Or more partially retired?
More partially retired. I am trying. I've been trying since January of '09. We're getting there. We are getting there, and that's why I'm here this evening. I'm going to be giving this evening one of my famous PowerPoint presentations. For those of you who were here when I worked here, we always had a PowerPoint presentation. Sometimes they didn't go too well, but...
Is the chicken in it? I just want to...
Staff has had this for several days. Your staff has. So if there's some, misplaced slides, it is not my fault. I just want to do a disclaimer. Not that I don't trust staff. Anyway, the reason I'm here is I am, as you know, leaving the Hands Clinic. I've been the executive director since 2009, and we built a clinic in the Saint Lucie County Logistics Center, thanks to the Board of County Commissioners. It's a fantastic operation. And I'm turning my responsibilities over to Roger Baker. Roger, please stand. Roger comes to us with a wealth of experience, and I think he's going to take this to the next level. As you know, I live in Georgia now, and it's just been too difficult to run this clinic because of the size of it remotely. It really has. And we need someone there on the ground full-time in St. Lucie County. Sitting next to Roger is Chris Self. She's our clinic manager. She just does a fantastic job, and as I go through this presentation, you will see a lot of the things that she does. And then we have our board of directors here. If the board could please stand. Now, down at the end, the Larry Lee that's standing, not the Larry Lee that's sitting. Okay, we always get confused here. But Larry is our chair, our president of the board. He's been that since the beginning. And there's Stacy, our secretary, Stacy Malinowski. And then we have Pat Alley. Everyone knows who Pat is. Pat is our treasurer. So we're in really good hands. I don't think we have any other board members here. When we do have a list of them in this presentation. The Hands Clinic, and you all deserve to be very proud about this, has just done some remarkable things in our community. And we're an affiliate of the National Organization of Volunteers in Medicine, which oversees a lot of volunteer clinics in our country. And they're based in Burlington, Vermont. And they tell us repeatedly that they're not aware of another clinic such as this one in the entire nation that is as comprehensive as we are. Not only are we providing health care to the needy in our community, we also have an adult dental clinic, a pediatric dental program, we have an ophthalmology department, we have a mental health department, we have chronic disease management, and the list goes on. And we're also now, and we're going to be talking about this in a moment, treating people with cancer. When we got into this, I was somewhat naive, to be quite honest with you. I thought we were going to be opening a clinic that was going to offer basic health care, sore throats, stomach aches, physicals, things such as that. And we have become a major player in health care. We offer, as I said, comprehensive health care to the people in our community who cannot afford it, and we do not charge a nickel for our services. Everyone that we service, and these are St. Lucie County residents, receive free care, not only from us, but our extensive network of providers. The 3 regional medical centers, Longwood, Saint Lucie Medical Center, and Martin Health System are part of our network, as is the Moffitt Cancer Center in Tampa. And our network goes on, and it gets larger. And our volunteers not only come from St. Lucie County, but they're now coming from Indian River County, Martin County, Okeechobee County. People from around the area are coming in to help St. Lucie County residents out. And I think that's something to be proud of, where this county can attract these type of people to help out our residents. So with that, I'm going to begin this PowerPoint presentation. And what do I hit?
Top left on the mouse.
Top left?
There you go.
Okay. All right. Now, the board of directors. As I said, Larry Lee's our president. Pat Alley's treasurer. Stacy Malinowski's our secretary. Dr. Flores is on our board. Catherine Hensley, Chris Adams, Chris Sands, and John Romano. You know, John Romano's with New Horizons. And as I said, we have a strong mental health component. Roger Baker's our new executive director. Chris Self's our clinic manager. Our medical director is Dr. James Roberts. Now, he works part-time. We pay him part-time, but he works full-time. He's our medical director. He is our only paid physician on staff. Dr. James Strawn is our volunteer dental director. We have an adult dental clinic with 4 operatories, and our adult dental clinic only has 1 employee. All of the other people who work in that adult dental clinic are volunteers. When a dentist comes in to treat our dental patients, not only does the dentist come in by themselves, they bring their staff with them because they're used to their staff working with them. So when a dentist is volunteering, they're also volunteering their entire staff. It's quite remarkable. I have to list our funding partners. I'm going to take a moment here because it is so important. These are people who are keeping us going, keeping us running. United Way of St. Lucie County, the United Way of St. Lucie County Standage Grant, which that helps fund our pediatric dental program. Allegheny Franciscan Ministries, St. Lucie County Health Department, the Board of County Commissioners by providing us the space. We have the Florida Dental Health Foundation. We have the Blue Cross and Blue Shield of Florida Foundation, tcpalm.com, Martin Health Systems. We have the low income pool, which we receive from the state. And our cash budget, our operating budget for cash is $1 million, of which $600,000 comes from the low income pool. We're concerned that that money will not continue forever coming in, and we're looking for replacement funding for that. That's one of our major goals. PNC Bank, Scripps Howard Foundation, Straticon. And by the way, Straticon, just to mention to you, one of the deals that we made when you gave us the space was that we would replace the air conditioning unit on the roof, and it was quite expensive to do that. Straticon came in and put the air conditioning unit on the roof for us for free. Children's Services Council of St. Lucie County, they're one of the prime funders of our pediatric dental program. Roseanne Gregory Cancer Foundation, that's a new foundation in our community. They've already given money to us. And then we have the Walmart Foundation. In 2012, HANDS and the community partners provided over $7.7 million in services at no cost to our patients. $7.7 million in one calendar year. The clinic provided $1.5 million. The dental clinic was $550,000. Pediatric dental services was $220,000. The area medical centers was $5 million. Then we gave away $400,000 free prescriptions and $75,000 other, but it was $7.7 million, almost $8 million in free care to St. Lucie County residents. 2013, believe it or not, that number could go as high as $10 million. It's just growing by leaps and bounds as our partners continue to grow. In our pediatric dental program, it's important to know that we treat the preschoolers through second graders in our community, plus we go into the summer camps. And I'll talk a little bit more about that in a moment. But so we treat the children in our community. We treat the adults in our community. Volunteers. Once again, I was naive. I thought, when we get into this, we'll be fortunate to maybe get 4 physicians to volunteer. Well, right now we have 94 physicians volunteering. Not 4, 94. 15 dentists, 11 hygienists, 7 physician assistants, 92 nurses. We have 32 people volunteering in our office. We're open Monday through Fridays and Saturday mornings and Wednesday evenings. We have a core staff of about 11 people. That's it. Everyone else is volunteers. And like we're open long hours. But it's remarkable. You add those up, that's about 200 volunteers. It's just incredible. Like I said, what's happening, not only from St. Lucie County residents, but residents from surrounding counties. Right now, we have 2,800 patients. The average patient comes about 3 to 4 times a year. We have 3,000 visits in 2011. We're going to have 5,000 visits in 2012. And when a patient comes to our clinic, they're treated with dignity and respect. The first visit is as long as an hour. When these people come, they're sick. They have a laundry list of what's wrong with them. And the physician spends a lot of time with them, taking the health background to prioritize how treatment should occur. We have a navigation system set up where, first of all, people come in and they pre-qualify to be our patient. Then they receive treatment. Once they receive treatment, they may need a specialist. Our navigation system helps them through the medical system in the community. And not only do we have patient navigators on board now, but the medical centers do. So when they've hired people in that, when someone goes to the emergency department or they're being discharged as an inpatient from being an inpatient, they work with those people to see if they could possibly qualify to be our patient. So like the hospitals are full partners now. Adult dental, 850 patients, and we've had 2,500 visits since opening in March of 2012. I've already explained that. And that adult dental clinic, it has 4 operatories. We have x-rays in each room, plus we have another room that gives you a full head x-ray. I don't know of any other dental office in this community that has the equipment that we have, and everything we have is paid for. We do not owe a nickel to anyone. Everything is paid for. Since 2012, we've seen a tremendous increase in cancer patients needing care, and we've listed those out here, the different types of cancer that we're seeing. Like I said, once again, being naive when we opened this, I never thought we would be treating patients with these types of serious diseases. But now they have a place to go. And if they have to go to Moffitt, if they can't get the transportation to go to Moffitt, Stacy and her folks help provide us through Mustard Seed Ministries the transportation to get them there. So not only are we treating these patients and getting appointments for them, we're helping get them there for their appointments.
They're in Tampa?
In Tampa, yes.
It's amazing.
The pediatric dental screenings, I've been told that number is now, 15,000 pediatric dental screenings we've given to the children of St. Lucie County. There was first graders, about 840 first graders a couple years ago were given oral health screenings in our school system. I think it was 46% of those first graders had dental decay. Unbelievable. Now what we're doing is giving oral health screenings to preschoolers through second graders, plus in the summer camps. We're tracking these children through our electronic medical record system. 48% less children require now emergency dental care. 22% less found with poor oral hygiene. 28% children are found now with no tooth decay. We've given out 17,500 toothbrushes and tubes of toothpaste to these children. Children are very honest, and when we treat these children, we ask them questions. Do you brush your teeth? Yes or no? In a lot of cases, what they're saying is, well, we try, but in our house, we only have one toothbrush, and we all have to share it. Or we don't have any toothbrushes in our house. So we are providing these children toothbrushes and toothpaste in school, so now after lunch every day, they brush their teeth. We also give them toothbrushes and toothpaste to take home with them. They're brushing their teeth. We're also teaching them proper dental habits, oral hygiene, proper diets, spending a lot of time with these children. And our dental hygienist who runs this, Irvin Velchen, speaks 3 languages. So he can converse with these children, which is very important, obviously. We're always in the need of toothbrushes. I'm always pleading to the community, we need toothbrushes. An average toothbrush lasts about 3 months. So, if people want to donate toothbrushes, we're in the St. Lucie County Logistics Center. Just bring them on over and, we'll accept them, and they will be put to good use. Higher education. We are now working with the education systems throughout our area where their students, their medical students, are now working at our clinic to get their clinical hours in, and what better education than actually working in a clinic such as ours. Plus, it is providing the care to our patients. It's a win-win-win. Florida Atlantic University, Florida State University, Indian River State College, Fortis Institute, Commissioner Mowry. I had that misspelled earlier today. I gave this presentation earlier, and he corrected me on that. Kaiser University, Indiana State University. As I said, we are starting to get national recognition, and now we have students from Indiana State University, Florida International University, South University. Where are we going? Well, the Affordable Health Care Act is coming into play. How is that going to affect us? Well, in St. Lucie County, we estimate that there are 50 to 50,000 people between the ages of 18 and 65 who don't have health insurance. Even when the Affordable Health Care Act is implemented, there's still going to be a lot of people in our nation and in St. Lucie County who will not have health insurance. A lot of people think everyone's going to be covered. They're not. But as that is implemented, if we have to adjust, we will adjust. Like I said, right now we don't bill anyone for anything, because if we did bill, our volunteers would not receive sovereign immunity through the state. They now receive sovereign immunity, which means we do not have to purchase malpractice insurance. Our faith community is increasing. We're working with that on a continuous basis. And we actually have a workshop where they're going to be present on Thursday, and we're continuing to nurture that because it is so important to have the churches involved. They know the people in their congregations who need the help, and they can provide us many services. We've written a book about our story. We actually employed Brenda Starr. Some of you remember Brenda Starr from the comic books. Well, it's not the same Brenda Starr, but her name is Brenda Starr. And we've employed Brenda Starr. They've written a real nice book about us. She just called me today, and we're getting ready to publish this book. She has some funds for it, and we're working to get the remaining funds in place to publish the book, to spread the story around the country, what St. Lucie County has done. And when we started this program, and all these organizations started going forward, someone came up to me and they said, "Doug, do you remember following the hurricanes, how everyone pulled together in this community to get this community recovered, to rebuild this community?" I said, "Oh yeah, I was right in the middle of it." They said, "Well, Doug, the community is doing the same thing with this clinic." So, we want to, everyone is pulling together. Like I said, they're helping us so much. Our business plan, we've written a business plan. We're working with Indian River State College now to go to the next phase of our business plan. We're in the process of forming a foundation. Dan Harrell is our attorney, and we're having a meeting tomorrow, in fact, to work on forming a foundation so that we hopefully can start replacing the $600,000 that we're afraid we're going to lose eventually through our foundation. Our goal is to have 3,000 clinic patients. The reason we're not exceeding 3,000 is simply we don't have enough space to accommodate more than that. Plus, we only have so many volunteers. We also want to have 3,000 adult dental patients. We want to increase our volunteer base by 4 volunteers per month. We're looking for a replacement for that low-income pool grant. I'm glad that the other Larry Lee is here this evening. And St. Lucie County, or St. Lucie Medical Center, is building an outpatient clinic. And it's going to be staffed with their interns. They're into a new program. And that is going to become a satellite operation of the Hands Clinic this fall at the St. Lucie Medical Center, where they will start seeing our patients. So perhaps we can increase that 3,000 number. But once again, they came to us offering this. And that's how this happens. People keep coming to us offering their services. I mentioned the book. We think it's going to be great to get the word out around the country, because if we can do this in St. Lucie County, why can't this be duplicated throughout our nation? And with that, we think this is one of the answers to the healthcare problem in the United States of America. I mean, if we can do this, this can be done elsewhere. So we want to get a book out telling people our story, get other communities enthused, and get them doing the same thing that we're doing here. To contribute, we have a website, or you can mail contributions or bring them to our clinic. And that's the end of my PowerPoint presentation.
Thank you, thank you, thank you. You know, Doug, before you leave, Doug, we want to say, obviously, thank you, if you don't mind. You've got to join us for another minute. We want to thank you for the service that you've provided to St. Lucie County. You talk about a stellar job. It's amazing to see what has come from dream to fruition with this project, and it's truly amazing to see the amount of time and effort that everybody has put into this, your time and effort. And so as you transition to baseball activities away from this, we're excited to see what you've helped create, excited about the team and the board that you have in place. And thank you so much for your efforts. So again, if the audience wouldn't mind, just a proud moment here as we wish you well as you continue on in other efforts.
Thank you. It's been my pleasure because this community has been very good to me.
Thank you. And one last comment as it relates to that, just for the audience's sake, in terms of the financial aspects for those that are seeking assistance, if you wouldn't mind just briefly touching on that.
Sure. Thank you. That's a great question. First of all, you have to be a St. Lucie County resident, and we do not treat residents from other counties. Your income cannot exceed 200% of the federal poverty level. That's your annual income. An example is a family of 5, it's approximately $50,000 per year. But we went to 200% instead of 100% so we could capture more people in our community. And there's a couple of minor other criteria. If someone's interested in, becoming a patient of ours, they need to contact us. We will set up an appointment with our patient navigator to take them through the process to see if they qualify. If they do qualify, then they'll become a patient. And when we hope that, that this does not become their permanent medical home, we want to get people back up on their feet, get them back to work, become valuable citizens in our community, and then they can live good lives.
Wonderful. Thank you, Doug.
You're welcome.
If I may, Mr. Chair. Doug, I just want to make a comment. I spoke with you earlier today, and you were telling me about the book project and also some of the things that happened at the Hands Clinic. I just don't believe that Hands Clinic is just meant for St. Lucie County, like you said. I believe it could be a phenomena all throughout the United States, but something started right here in St. Lucie County. And with that book behind it, with the commitment behind it, I believe we can have hands touching lives all over the United States in a medical way, despite, in spite of the income ratio, in spite of the differences in the challenges that people face. There still is a means for services to be provided, and we need to take a proactive approach to continue this process and make sure it happens. And we want to appreciate you for your service, for your commitment, and all that you've done in order to allow the hands to touch St. Lucie County.
Thank you so much. Thank you. And we are going to continue, the staff is going to continue to improve it, to expand it. And like I said, we're starting to get national recognition, and I really think that this could spread throughout the country.
Great job. Excellent.
Thank you, Doug. This time we're going to turn to our proclamation. And with that, we're going to ask for our clerk to please read the proclamation.
Resolution 13-30, a resolution proclaiming June 11, 2013 as a no-kill county for just one day in St. Lucie County, Florida. Whereas the Board of County Commissioners of St. Lucie County, Florida has made the following determinations. June 11, 2013 has been recognized as a no-kill nation for just one day, honoring the 11th year anniversary of the founding of the No Kill Advocacy Center and its efforts to save the lives of dogs and cats, which might otherwise be euthanized in shelters every year. Animals improve our health, protect us from danger, and teach us about caring and responsibility, and are often considered cherished members of our families. The no-kill movement in the United States has successfully implemented new and innovative programs that provide alternatives to euthanasia of shelter animals. Further development of no-kill advocacy programs has the potential to save even greater number of shelter animals. On June 11, 2013, animal shelters and rescue groups across the county will join together as a no-kill nation for just one day to create the safest day for shelter animals in U.S. history. Now therefore be it resolved by the Board of County Commissioners of St. Lucie County, Florida. This board does hereby proclaim June 11, 2013 as a no-kill county for just one day in St. Lucie County, Florida. This board urges all shelters and animal groups in the community to support a no-kill county for just one day on June 11, 2013 to make a difference in the lives of shelter animals, even if it is just for one day. Passed and duly adopted this 4th day of June, 2013.
Thank you, Madam Clerk. This time, we have a boatload of individuals here on behalf of this. We're excited to have you here. And if you wouldn't mind, Sally, Jay, if you'd like to join us, we're going to allow you to tell us a little bit about this. We want to do a photo. Jack, if you wouldn't mind, come up. Do you want to have your whole group come up first for the photo? Would you like to do that?
Everybody who wants to be in this photo, who's come here for the animals, please come up. Really?
Yes,
That's
that'd be great.
Wide-angle lens.
Everybody. Everybody.
You're going to need a wide-angle lens.
We're going to turn to
This is glorious. Thank you. I'll stand with, I'll be on your side. Oh, great. What a left to right.
Come on around, folks. Come around the back side.
Where do you want?
Jeanette? Jeanette, you want to come around over here? Come around the back side.
Over here. That's your shirt right here. That red shirt right there. Come on. Hey. Miss Raining Cats. Miss Raining Cats and dogs.
Squeeze in. Squeeze in.
Let's hold this together.
Move back. Squeeze in.
Maris, are you on this? Good. Good, okay. Blink, Jack. Thank you. And I'm letting this go to Jay.
Okay.
Thank you.
Thank you.
Yes. Oh, could we get one more picture with Maris in it?
This is from Martin County. We were just given our proclamation.
Yes, we were going to call you. It just was so exciting to see all these people.
Come on up. Move up a little closer.
Okay.
Great.
Thank you.
Okay.
Thank you.
Microphone's yours.
Oh, thank you.
Thank you.
May I please present Marisine, excuse me, Jay, because Maris has to really get home fast. Maris is the director of Domino's No Kill Cat Rescue League in Palm City, and we have 2 home runs here. We have a proclamation from our wonderful Board of County Commissioners, and Maris today was presented with a proclamation in Martin County by the Board of County Commissioners in Martin County. So this is a double home run for the animals. It's very exciting, and this took a bit of doing, but the spirit is in the community, and the dialogue
Sally,
is in the community.
if you don't mind facing this way.
Oh, I'm sorry.
We have your cameras right here.
Oh,
facing you.
gosh.
You got a lot of people at home listening to you as well.
There you go.
Thank you, commissioners. And Maris, please just hold it up so everyone can see this. This is from the Martin County Board of County Commissioners. It was presented today.
They are nice folks, just like you all.
Wonderful.
Yeah.
Thank you all so much.
Caring for St. Lucie County.
You're welcome. May I call Representative Larry Lee up here to join Jay and myself, because you have really been working this from the top end in the state. Hi, I'm Sally Berquist. I'm so pleased to meet you finally in person. Jay Apicella.
Nice meeting you.
Would you mind just sharing briefly your shelter transparency bill that you helped get going for the governor's signature?
Well, this was a bill that was introduced in the House, and I, along with, I think it had unanimous support.
It did.
In the House. And we were happy to support it. It's a good thing. And animals, I guess, going to Tallahassee was an eye-opening for me in so many ways, but animals, and I was talking to someone just yesterday about how the work that you do with animals. My heart became very soft, in particular with people who fight dogs. That's something that I want to take on as a project, to try to get people to see that that's so cruel to have animals fighting. And so actually, I'll become an advocate for you.
Yay! Thank you. Jay, your few moments of fame?
Yeah. Hi, I'm Jay with Dogs and Cats Forever. I want to really thank you, commissioners, for doing this and making it possible. And I hope this one day will turn out to be every day. Thank you.
Thank you, Jay. Thank you very much. Representative Lee? Representative Lee, if you don't mind, and I know you and I mentioned, I'd like to actually have you take a few moments just to update us on your activities. Obviously, you're back. Session has ended. Welcome to our county board meeting tonight. We're glad to have you here, and the mic is yours.
Well, first of all, I'd like to thank you and all the work that you do. And just to say that after 30 years of pondering and considering whether I should seek public office, I got out there, and my hat's off to you, because this is not an easy job, and I know Commissioner Lewis and Commissioner Hudson Hutchison has probably been around longer than anyone on the board, but no matter how long you're out there, it's always a challenge. And so my hat's off to all 5 of you for the work that you do and the commitment that you have for this county. And I meet and talk with you. I think I've had a conversation with the 3 of you today, and I've talked to you several times about the things that I face in Tallahassee. I seek you for advice, and Todd and I were talking this morning about a project that we're going to be working on, and Chris and I were talking before then, and then Kim, so I mean all 3 of you. And just for the record, it was we didn't violate any sunshine, so none of them were together when I was talking to them. But while serving this my first term in Tallahassee, we were very fortunate to get 2 bills unanimously presented, sponsored that I sponsored in the House. One was a literacy bill, and it passed all 3 committees that it had to go before unanimously, and passed the House unanimously. And I felt very good because I was the first freshman to get a bill heard on the floor and passed out of the House. And unfortunately, the governor felt that that program should not take place. It was a pilot program that was going to take place here in St. Lucie County that we were going to use as a model all over the state, should it be successful. But we're going to move forward with it anyway, and with the community support, and bring it back up next year. And it was targeting 2 and 3-year-old children with a literacy program. And literacy is tied to success in life. If a child is not reading by the 3rd grade, by the time they get to the 3rd grade, their chances of dropping out is greater than their peers. And that's what this program was all about. And we noticed that literacy, there's a correlation to crime. And our current Sergeant of Arms is a former warden. And when I presented that bill, he pulled me aside, his name is Russell, and he told me that the average reading level of a prisoner is 5th grade. So you can see that there's some correlation there. So we're going to continue to work there, and we have an insurance bill that I presented that we hope that will help ease the pain of some people, and as well as my greatest disappointment was the failure to come to some compromise or agreement with the Medicaid expansion. And that's something that we're going to be taking another look at when session convenes. But my heart was so warm today when I saw the presentation of what we're doing here in St. Lucie County with hands. And that can be, as Commissioner Johnson stated, a model. And I want to take that back to Tallahassee and let my colleagues from the other counties hear about what we're doing down here in St. Lucie County. But it was a unique experience, and what I was able to do is put a lot of the partisanship aside. You all don't deal with that much on the local level, but in Tallahassee and Washington, D.C., that's the problem, that nothing gets done. You have people on both sides of the aisle that are constantly not wanting to budge, not wanting to give. But we were able to get some things done this year, and I think we had a great session. We're going to be putting a focus on the lagoon. You've probably been reading a lot about that in the newspaper, and there are several theories out there. And the last 3 weeks, I felt like I was back in college again, taking chemistry courses and learning a lot about the environment. But we're truly blessed, and we got some interesting things going on within our lagoon that we need to deal with. And these past 3 weeks has convinced me how committed I need to be, because our planet is truly sick. There's a lot of things happening. We don't know why they're happening, but it's a lot of research out there. And over the coming months, I think things are going to be revealed that will help us better understand our estuaries and our lagoons. I don't want to take up much of your time, but Commissioner Towery, thanks for giving me this moment, and I entertain any questions if any of you have any. And Commissioner Lewis, I heard that you had a little episode there, but I'm glad to see that you're back up.
Thank you.
Excellent.
Thank you.
Mr. Chairman, Representative Lee.
Got to get used to that, right?
I know. I'm so used to calling you Larry.
You still can. I'm still Larry. I always will be.
Just to put an exclamation point on what you talked about on the reading side, I was reading where there was a sheriff in the nation, then when asked, how do you project so accurately the number of people who are going to be in your jails. And he says, I look at third grade reading levels 20 years prior, and I can tell by those scores and how many people are failing in reading, and they projected somehow through that statistic how many people would be in their jails, and they were very, very close off 1%, give or take.
I'm glad you mentioned that. The data out there is amazing, and you're so right. You know, and the thing that troubles me and some of the other legislators up there, in Tallahassee and around the country, we spend more time and money treating the problem. And once you invest in these jails, that's not the cure. You know, they're constantly building more and more jails. If we could teach those kids 2 and 3 years of age, that's not too early. Teach them about the importance of education. You will see some of this crime start to decrease. One of the shootings just a couple weeks ago involved a 15-year-old right over there in Sheridan Plaza. And the very next day, 2 people were murdered in the very development that we were going to implement this program. So you're so right about what that sheriff said. They predict how many beds they will need based on the reading level of third graders. But we need to invest on this side, and I tell this story a lot. People don't realize the recidivism rate that we have is largely due because these prisoners are released from prison with a felon on their record. And once that happens, they can't find a job. So they're out on the street. They say, you know, at least I was in prison. I had a roof over my head. I had 3 meals a day, and I had health care. So they go back. And that's a burden on us. That's why we need to make sure that we have interventions working with these kids at a very early age. And I know your hearts. I know all 5 of you, and I know that you'll do all that you can to help with this problem in the future. But thank you for your time.
Thank you, Representative Lee. Appreciate it. This time we're going to turn to Lois Hubbard, and we're going to have a presentation on the state of homelessness here in St. Lucie County.
Hi, good evening. Louise Hubbard, Executive Director, Treasure Coast Homeless Services Council. I'm not a stranger to all of you. I live in St. Lucie County. Treasure Coast Homeless is Indian River, St. Lucie, and Martin. It is a HUD continuum of care. That's the most annoying name I've ever heard, but that is the name. So essentially what I wanted to tell you tonight focuses primarily on St. Lucie County, because it's our responsibility to work with St. Lucie County and Community Services to assure that we could prevent as much homelessness as possible and also attempt to address it. So essentially the continuum of care, which nobody understands very well because it's complicated, starts with prevention. And as you can see from the top, there's a lot of community support, a lot of United Way, a bunch of government and foundation funding, primarily in the form of competitive grants. Our COC in the last 10 years has now brought $27 million in federal money to this area. St. Lucie County's gotten a pretty nice piece of that money annually because we have a great relationship and we work very hard to bring in federal grants. In addition to that, you'll see that we have outreach, intake, and assessment. That's the beginning of identifying people, trying to figure out what the best triage is for their services if they exist. And then you follow up with assessment, send them to an appropriate location if you can find one. If you look at emergency shelter, you'll see some of the names of the programs that do exist where people go when they need emergency shelter. St. Lucie County doesn't have an emergency shelter, by the way. Then there's transitional housing. You'll see the names of the places in the continuum where we send kids, adults, families with children, and ultimately the neighborhood stabilization and permanent supportive housing. It's part of that continuum to try to people move in, out as fast as possible, not sustaining people in any one location too long, and try to get self-sufficiency as much as possible. If you see on the bottom, the underpinning is attempting to develop consistent opportunity for self-sufficient. living back in the community so people can pay their bills, pay their taxes, and do stuff like that. The three primary functions, as you can see here, is actually operating the COC, and we have 7 staff members that run 3 counties, and we have lots of colleagues in each of the counties who also work with us. Then the other thing is designating and operating a homeless management information system, which means every person's activity in the system is in the system forever in a confidential database. So anybody who goes to Stacy at Mustard Seed is also known to have gone to the United Way or to any other providers in the community or any other community, and you know immediately where they've been, what they've gotten, what their demographics are, so they're not stuck with having to do it over and over and over. Saves a lot of time. Good tracking and very efficient. And finally, our job is planning. What I wanted to share with you tonight, these are how these things work. Okay, this is what we do. First, we have to establish targets for the subpopulations. What that means is nobody can do everything for everybody. Essentially, we are responsible for reporting performance. Can I serve 500 people? Yes. What can I give those 500 people? What are the targets that I can expect? And this is a collaborative application. There's probably 65, 70 people that meet every other month from the 3 counties, and we discuss what can we do. The next part is, if we gave you money, what did you do with it? How did you spend it? The next one is, what were the outcomes? Did we spend it wisely? Did we put people back to work, or did we just keep them in a place that didn't do them any good either? And then we have evaluation reports and telling HUD everything because, of course, they need to know everything. And then finally, they have written standards that are national in scope so that there's uniformity and consistency, so that there's no discrimination, so that there's no attempt to say this county does this way, that one does it that way. You've mistreated me, or you haven't done what you should for me. So it's statewide standards, national standards that you have to meet. That being the case, this HMIS is called a Homeless Management Information System. Essentially, it's a misnomer. It should be called a Client Management Information System because it is a centralized and coordinated assessment system. St. Lucie County does participate. People are evaluated routinely, consistently, and across the board. If you see that little treasure coast thingy, those are the counties in which the HMIS participation happens, so that we're able to tell who is in the system, who's been in the system, what we can do to prevent future, episodes of either homelessness or to try to prevent it altogether, how many children they have, what their income is, where they've been before, etc. When you go to the next slide, this is essentially, this continuum of care has to be easily accessed. It has to have network connectedness, and it has to have coordination. So what does that mean? That means we're on everything, is what it means. Everything from 211 to every possible resource directory on every website, in a newspaper, any place where people know where to come. So if somebody calls Stephanie's office, she'll call us immediately. If somebody calls Stacy, we call Stacy, she calls us. Any of your providers in St. Lucie County are colleagues, readily accessible and cooperative, so that we can work together to do the best we can, but to bring the most impact for the money. And I have a guy who likes to play with this stuff, can you tell? It is a standardized assessment tool, which I won't bore you with, but essentially everybody gets asked the same questions the same way across the board, no matter what, so nothing is left out. What I wanted to share with you tonight mostly is this. One of our big responsibilities is counting. On an annual basis, we are required to count on one night individuals and families who are in the street. This is called a street count. It's a homeless count. HUD is very tight about it. Very tight in terms of who can be counted, who cannot be counted, how you conduct the count, how many hours you can engage in the count. People who are on the borderlines are not countable, etc. St. Lucie County does a great cooperative job with us. And there's all kinds of agencies involved in the count on a regular basis. It was January 31st, 2013 this year. And here are the results. Oh, you can skip that one. Okay, 915 people in the street on that night in St. Lucie County, in the street. That is not in a shelter. That is not in a program. That is in a street, doubled up. It does not count in this situation. You must be living in a car. You must be behind Walmart. You must be in a tent. You must be in the savannas. You must be walking around at 3 o'clock in the morning. The only thing that does count is a domestic violence shelter, which you don't physically have. 40% of the people we counted were kids. That's people under the age of 18 who were with their parents in the street, or a lot, terrible amount of school-age kids living in cars behind Walmart so they can go to school, take a shower, so nobody knows. We had to verify these numbers with the school district, and you will find the school district to be extremely nice in St. Lucie County, very cooperative. And the liaison, there's a HUD liaison, but this homeless liaison, they counted for us. It's true. In addition to that, you'll see that the first-time homeless number has gone way out of control. There's an economic indicator. People who assume homeless automatically assume chronic. Apparently, that's not the case any longer. There are people who have been working forever and finally reached the end of whatever, including a foreclosure process, a factory closure, unemployment ran out, extended unemployment ran out. They finally got evicted. There's a lot of evictions that are unofficial, shall I say, as opposed to official. Lots of people get dumped out without much resource, and they don't often get counted. What you have here is 81% of the people that we interviewed lived in the county for at least a year or longer. It's a very specific question, and you have to show us one thing that proves that. You have to show us something, a bill that came to your house 2 years ago or something. 81% of the people that were homeless for the first time has lived in this county for a year. 35% female, 65% male. These are the adults. Okay. And the winner is unemployment. There are questions that people have to, all of the people who ask these questions are trained. You can ask Stacy, she'll tell you, or Stephanie. They train them all. This is how you ask this question. No, you don't ask that question, you ask this question. The choices for those who answered, 70% said because we're unemployed. That's St. Lucie County data. And that was in January. Hopefully it's getting a little bit better. But that's the reason that they gave for homelessness. Why are you homeless? What is the reason for your homelessness? %17% reported that they were homeless because they were disabled. That whole conversation about share of cost, Medicare, all the Medicaid stuff, I get it, totally. The hands clinic, I totally get. People spend all their money and then they have none. And this is how the population looks, which is pretty normal, black, white, and other. I don't know why they want that stuff, but they do. The next one will show you that it's 48% white, 39% black, and 13% other. This is St. Lucie County's homeless population demographic right now. In addition to that, we found 42 people between the age of 18 and 24 who were homeless in St. Lucie County who would admit to it on that day. 18 to 24 is a new population group that we're looking at, because those are kids that have aged out of foster care in a lot of cases and have no resources. There's a whole new thing called homeless in high school. I don't know if you've heard about it, but there are kids who are 18 and 19 who are homeless because after 18 you don't get, the person who fostered them doesn't get paid for it, and so in a lot of cases they're gone, left to their own resources. There's a new population that's emerging It's small, but that's 42 people that we found in that age group. This one is the toughest of all. I can't believe this. That number's just ridiculous, okay? We have a difficult time counting veterans. I don't care what we do, who we send out, or how we do it. And we have veterans that go into the woods, put up the signs, but I'm sure there are way more than 49 homeless veterans in St. Lucie County, honest. But those are the only ones that would come forward. And when you ask them why, there's a plethora of different reasons, but I don't think that their current confidence level, especially the younger ones, the ones that are just coming home now, their confidence level isn't very high, so they won't step forward to be identified. I bet you that's much higher than that. And now, if you want to take a look at this, what you'll see here is nationally the two-bedroom rental unit housing rate. The housing wage that Florida needs in order to afford a two-bedroom, Florida, is $19.14. That's the housing wage that would make you only have to pay 30 to 35% of your income for housing. As you can see in other places, it's much higher or lower, depending on where you are. It kind of varies, but that's the Florida housing wage. That means basically you got to work 40 hours a week, 52 weeks a year, in order to afford the fair market rent for a two-bedroom unit without paying more than 30% of your income. And the phenomenon that we've noticed since people have lost their homes, the rents are getting crazy. For a while, rents were very manageable in St. Lucie County with the money that we get, because we get shelter plus care dollars, which is another story, to pay rents for disabled people in St. Lucie County. But lately, the rents are like really ridiculous. They're just going all over the place. The market is moving that phenomenon. And 2013 housing wage is $18.08 to afford a two-bedroom market rent in St. Lucie County, $18.08. I don't know a lot of people that make $18.08, but that's what you need to make in order to afford the fair market rent. I had a piece of paper in my hand which tells you what it is, but two bedrooms is 9-something now. For a regular two-bedroom apartment, a fair market rental rate by HUD is $9.56, I think. Stephanie would know, buddy. Remember it? What? Oh, there you go. Yep, thanks, Steph. $9.40. That's pretty high. That's pretty high for a two-bedroom apartment. And those don't come with utilities, by the way, in all cases. And then you need to make $37.6 in order to do that two-bedroom thing. Full-time jobs that you need to have at that rate, 2.3 to afford a two-bedroom at $11, which is the standard median. Area median income is $53.3. I think that's high, but that's what the current area median is. That's when 4 people in the family, 2 wage earners, $53.3. And finally, this is what estimated mean renter hourly wages for an hourly worker in St. Lucie, $11.54. And I want you to know it's better than Indian River. It's higher, actually. You have 25,000 renter households in St. Lucie County. So that accounts for a lot of the evictions, a lot of the problems that we have trying to prevent. The biggest thing we do is prevent. If we can pay rent, pay utilities to keep somebody in the house even one more month so they don't get kicked out, maybe they'll get a good job. That's what we do. And how do we take action? Well, our biggest one, of course, is just like yours, NSP. We provide services and programs. That's what we do. We fight for every federal dollar we can steal. We fight for every foundation we can get money from. It's a constant battle to keep money in the house. NSP, we have NSP. You guys know what neighborhood stabilization is, I think. That was a federal program in which we purchased, but we did not purchase rehab resell. Purchase rehab rent. Purchase rehab rent is a 15-year nightmare in which we own the property whether we like it or not, and charge 30% of people's income. In some cases, our rents are $217 a month because that's all they can afford. But it does a nice job of cleaning the neighborhood. And then we have our famous Shelter Plus Care, which I think some of you know about, administered by you guys here and Stephanie Myers and Beth Ryder. Essentially, right now, we're at 55 to 58 severely disabled adults who are in permanent housing in St. Lucie County forever, eventually. No one can kick them out as long as they are maintaining the apartments. We pay the landlords, or you guys pay the landlords directly at a fair market rate. That it's economically sound community dollar, because the assumption is that the landlord who gets the check at least pays his own bills, spends money here. The money does not go to the client at all. John Romano, New Horizons, is one of the biggest providers of supportive services to this population. There are others as well. It's a lot of work. You can just ask what used to be called community services, how difficult this job is. But we do very, very well. And we've had great success with this program because we keep people out of jail, we keep them out of hospitals, and we essentially save them from walking around the streets and getting into trouble or getting back into the hospital, which is terrible. And then finally, we do a lot. We are a certified HUD housing counseling agency, not like the ones that charge you money. It's free. We try to keep people in their homes. That's what we do. Even though we're saddled with the name homeless, our biggest role has always been prevention of homelessness. And these are just some of the places where we get money, okay? Our biggest expenditure annually, we do about $3,000 rent and utilities a year for Indian River, St. Lucie, and Martin. And St. Lucie gets a good share of that. But about 3,000 people a year get help to prevent them from falling into homelessness, and through our different grants. And the outcome is this little cute thing. Everybody's happy in their little house, home sweet home. That's it, ladies and gentlemen. Thank you.
Thank you. Thank you, Ms. Hubbard. Appreciate the presentation. By the way, I know that Larry Lee and myself and some others have been working to try and help connect the dots. There's a group that is wanting to develop a fairly substantial homeless shelter here in the county to try and aid in some of these efforts and move some things forward.
So you're talking about Graceway Village?
No.
Oh, there's another one.
Yep, so we want to try and connect you with that to help make some things happen.
I've been connected, I think. Thank you.
No, with this other group that's looking, not Graceway, different. So we want to have them connect with you so that they can better understand some of the things that are going on. So thank you for your time and your efforts.
Thank you.
Thank you. Okay. One more presentation. It's been a presentation night. So without any further ado, with that, we'll turn to Susan Jacob, our Library Services Manager. And she has some exciting goodies to talk about here as we talk about the summer reading extravaganza.
Thank you, Chairman. Good evening, Commissioners. Good evening. For the record, I'm Susan Jacob. I'm the Library Services Manager, and I'm here this evening to talk to you about the library's planned summer reading program. Representative Lee, you couldn't have been a better opening act for me, so thank you very much. Obviously, the library is a major supporter of literacy in this county, and we work very, very hard to provide services to all of our residents. This summer, we have a very robust program planned for the kids and young adults. But I wanted to just start my very brief presentation off with a quote, because I'm a librarian and I always have to start off with a quote. Mark Twain, "The reports of my death have been greatly exaggerated." And I would like to say that the 2013 summer reading program of our library is proof of that. Since 2010, the library's been, since the cuts of 2010, the library's been fighting their way back. And I think this summer's program is proof that we're on our way to flourishing again. So I thank you, commissioners, for your support of the library. And so this summer, the library is, the theme of the library's summer reading program, like many libraries around the state, is Dig Into Reading. And we are taking a three-pronged approach. Part of why we support summer reading programs is that statistics have shown that kids, during the summer, kids lose ground in their reading. If they're not encouraged to read, and if they don't read, they lose ground. And we don't want to see that happen. So that's why we have our wonderful three-pronged approach this summer. We're featuring performers and entertainments. We're having a reading incentive program, which we haven't had in this county for many, many years. And then we're also going to use our local talent for story hours throughout the county. Starting with our children's specialists, every day in the week that the library's open, we'll have a story hour at some place around the county. And that's a little challenging for us because right now we only have 3 children's specialists who kind of work a circuit. They're kind of circuit judges, kind of like circuit judges. They travel from library to library. And so this year, any morning of the summer, any kid can find a story hour, and our very creative children's specialists will sing, they dance, they read stories, they do movement, they get the kids to move. They basically do anything they can to get younger kids excited about reading and about books. And also to teach their parents what it means to help your kid read. That's part of the literacy also, teaching a parent who may or may not be comfortable reading to read to their kids. The second part of our program, well, the library can't, obviously, even with the wonderful support we get, provide programs throughout the summer. So we look to local organizations, local talent to supplement our program, and I just put up a couple of those. Dogs are very big. 2 of our programs, we're going to have the Sheriff's Department is going to be bringing their canine dogs and showing the kids that. But then we're using one of our library staff in a different capacity. Dot Blair runs a volunteer program with dogs, and she's a dog handler. And we have a very popular program called Pause for Reading, where kids come in by appointment and they get to sit down and read to a dog, which kind of sounds a little ridiculous. But for those of you who know, we've had this program off and on for many years, and kids who are shy about reading to an adult will absolutely love reading to a dog who listens to them. And that's just a sampling. We have archaeology programs. We've really made contacts and networked to get anybody who has anything fun to come in and do it in one of our libraries. Literacy is not just about books. And a library is not just about promoting books. It's also about cultural literacy. So an important part of our program, and I believe that, is to bring in entertainments, educational entertainers, to help kids have exposure to music and art and ideas and music, things that they wouldn't see in their neighborhood, that they may not see in their schools. So we have 5 weeks where we have 5 different performers giving 4 performances each week. And these are wildly attended. I mean, hundreds of kids come to these programs. Morningside, in the past, Morningside has had to turn kids away. Hurston Library, we built that beautiful Hurston expansion with the community room. Last year, the first summer reading program we couldn't even fit all the kids who came to the first program in the room, so we just moved all the furniture in the main part of the library, and there were probably about 200 kids sitting in there for the first performance. We're expecting even more kids this year at more of our shows. We're really grateful to the Friends. Part of the money they raised at their annual dinner helped us hire 2 extra performers this year, so we'll have 5 weeks with 4 performances. Last leg is our summer reading incentive program. Kids come in, kids K through 8 get prizes, and we handed out some of that in the packet. Every 5 days they read, they come in, they get another prize, and these are very modest prizes. This is really to put the fun into the reading, that's number 1, to get some excitement, but also all of the library staff this summer is responsible for talking to kids about books, not just the children's specialists. Everybody is invested this year in asking any kid who comes into the library, what are you reading? Can I get you a book? And it's a collaboration, staff, parent, the kids. And then our grand finale prize for a kid who reads 30 days in the summer reading is everybody gets one of these Saint Lucie County Reads sports packs. And I know these seem small, but we already we made it into the editorial page in the paper this weekend. So we haven't even started the program officially yet. As of when I left, there are 150 kids already signed up for the summer reading incentive program. We've prepared for 300. We haven't done this in years. I have a feeling we're going to be making a little trip down to our supplier for more prizes, and that'll be great. You know, I hope I'll be able to tell you that we had at least 500 kids finishing this summer. And then so that's the overview. I promised to keep it brief. Last year, over 3,500 youth came to one of our summer reading programs. I don't really know what to expect this year, but we're anticipating many more. The libraries are busier and busier. Thank you for your help. Thank you for letting me speak to you. Thank you for helping getting the word out. And I hope it's going to be a great summer. And I hope I'll see you all in the library. Thank you.
Great job.
Thank you. Thank you. Susan, you definitely have been a great addition to our team. I love what you've been able to do with the libraries. I know that Beth is tickled as well. It's just been wonderful to see what you've been doing. The volunteer luncheon that you recently had was outstanding. The number of volunteers that you're getting to coordinate and consistently help has been truly wonderful, and we're so pleased with what's going on. So we get to have our St. Lucie County Reads bag, so that's wonderful. Just thank you for your efforts.
Thank you so much. Thank you, Commissioners.
Good job.
Okay. That concludes our presentation portion of the meeting. At this time, we're going to turn to our general public comment portion of the meeting. Anyone wishing to address the board, please do so at this time. And if you wouldn't mind, provide your name and address for the record. Good evening.
Good evening. My name is Sharon Cooper.
You can pull up to the microphone if you want. There you
better?
go. Thank you.
Hi, my name is Sharon Cooper. And ladies and gentlemen of the County Commission, county staff and guests, we would like to share with you the necessary steps in the journey to help St. Lucie County become a no-kill community. It's called the no-kill equation. 2 decades ago, the concept of a no-kill community was little more than a dream. Today, it is a reality in many cities and counties nationwide, and the numbers continue to grow, and the first step is a decision, a commitment to reject the kill-oriented failures of the past. No kill starts as an act of will. The next step involves putting in place the infrastructure to save lives. Following a commitment to no kill is the need for accountability. Accountability means having clear definitions, a life-saving plan, and protocols and procedures oriented towards preserving life. But accountability also allows, indeed requires, flexibility. Too many shelters lose sight of this principle, staying rigid with shelter protocols, believing these are engraved in stone. They are not. Protocols are important because they ensure accountability from staff, but protocols without flexibility can have the opposite effect, stifling innovation, causing lives to be needlessly lost, and allowing shelter employees who fail to save lives to hide behind a paper trail. The decision to end an animal's life is an extremely serious one and should always be treated as such. No matter how many animals a shelter kills, each and every animal is an individual, and each deserves individual consideration. And finally, to meet the challenge that no-kill entails, shelter leadership needs to get the community excited to energize people for the task at hand. By working with people, implementing life-saving programs, and treating each life as precious, a shelter can transform a community. There are communities in the United States that have eliminated population control killing. We want, and the animals deserve, no kill in every city in the country. But it requires shelter leaders committed to these goals and embarking on a campaign of diligent implementation. That is where we must focus our efforts at reform. Only the no-kill equation model has achieved this success. It is a program model which changes the way shelters operate and which gives the animal-loving public an integral role in that operation. If a community wants success, this is the way to go. Nothing else has succeeded. No-kill shelters can be public or private, large or small, humane societies or municipal agencies. A no-kill shelter can be either limited admission or open admission, and there are plenty of no-kill animal control shelters and thus no-kill communities which prove it. An open admission shelter does not have to and should not be an open door to the killing of animals. In fact, using the term open admission for kill shelters is misleading. Kill shelters are closed to people who love animals. They are closed to people who might have lost their job or lost their home but do not want their animals to die. They are closed to Good Samaritans who find animals but do not want them killed. They are closed to animal lovers who want to help save lives but will not be silent in the face of needless killing. And so they turn these people and their animals away, refusing to provide to them the service that they are being paid to perform. The mandatory programs and services of the no-kill equation include, number 1, Feral Cat TNR program. Trap, Neuter, Return, or TNR programs for free-living cats allow shelters to reduce death rates. This is the only proven method for lowering the numbers of feral or unowned cats in an area. We believe that even though these cats are not adoptable, they should be allowed to live because TNR actually succeeds in lowering the population.
Number 2 is high volume.
Hi, good evening. If you wouldn't mind, just
I am so
your name and address.
I just couldn't wait to get to it.
I know.
My name is Marilyn George, and I live in Port St. Lucie.
Great, thank you.
Item number 2 is high volume, low cost spay neuter. No and low cost, high volume spay and neuter reduces the number of animals entering the shelter system, allowing more resources to be allocated towards saving lives. Rescue group transfers. An adoption or transfer to a rescue group frees up scarce cage and kennel space, reduces expenses for feeding, cleaning, and killing, and improves a community's rate of life-saving. Because millions of dogs and cats are killed in shelters annually, rare is the circumstance in which a rescue group should be denied an animal. Foster care. Volunteer foster care is crucial to no kill. Without it, saving lives is compromised. It is a low-cost and often no-cost way of increasing a shelter's capacity, caring for sick and injured or behaviorally challenged animals and thus saving more lives. Adoptions are vital to an agency's life-saving mission. The quantity and quality of shelter adoptions is in shelter management's hands, making life-saving a direct function of shelter policies and practices. If shelters promoted their animals and had adoption programs responsive to community needs, including public access hours for working people, off-site adoptions, adoption incentives, and effective marketing, they would increase the number of homes available and replace killing with adoptions.
Also part of the equation is pet retention programs. And
again, if you don't mind, your name and address would be great. Thank you.
Oh, Diane Shaw, 199 Liberty Way, Fort Pierce.
Great, thank you.
Lakewood Park, sorry. Also part of the program is the pet retention programs. And when some animals are surrendered to the shelters, it's unavoidable. But others can be prevented, but only if the shelters work with the people to help them solve their problems. Saving animals requires the shelters to develop innovative strategies and for keeping people and their animals together. The more the community sees the shelters doing this and this taking place and giving advice and assistance, the easier this job's going to be. Also, medical and behavior programs. To meet its commitment to a life-saving guarantee for all the savable animals, shelters need to keep the animals happy and healthy and keep animals moving efficiently through the system. To do this, the shelters have got to put in place a comprehensive program for vaccination and handling and cleaning and socialization and care policies before the animals get sick. And also rehabilitative efforts for those who come in who are already sick, injured, unweaned, or traumatized. Thank you.
Thank you.
Hello, my name is Danny Kresge. Hello, Commissioner. We met before, Commissioner Johnson. I want to thank you all for denoting a day to be considered a no-kill animal day. I think it makes many people aware of the fact that there are too many animals in the United States, Saint Lucie County, and everyone in between, where we're killing too many. I favor and am in favor of a no-kill society for dogs and, well, I can't talk about cats, I can only talk about dogs. But I do favor a no-kill society for dogs, but it can only be reached if at some point in time a mandatory spay and neuter act is put in place. Unless you stop new birth, you will never stop strays on the street. You will never stop the killing of animals. We kill 10 million animals a year in the United States of America. We have rules and regulations in some cities that are abominable. They need to be changed. My thoughts on this mandatory spay and neuter: a lot of people would object and say, well, if someone is breeding dogs, they should be allowed to. It's their property. Well, we have a serious problem here. If we could maintain a spay and neuter program for 5 years, in 5 years, you might see the numbers. Let's just say in the Treasure Coast area, we're killing 50,000 dogs a year. That number might come down to the first year maybe 45,000 and then 35,000, and eventually maybe we're only killing those that truly have to be put down. I feel if we're able to create a spay and neuter policy here, which exists in Los Angeles County and is very successful, this could spread in other cities within the Treasure Coast and Florida area. Commissioner Mowry's aware of a proposal that I submitted, as the other commissioners are. I've only spoken with Commissioner Mowry about it. I had a chat with Commissioner Johnson about it, and I'm hoping that this ordinance that we have in St. Lucie County is changed. It's unfortunately very weak. It doesn't protect animals. It almost allows animal abuse. I've submitted the proposal. A committee was formed aside from that matter to go over it, and I've been in touch with the committee, and so far it looks like we are making progress. I will stay in touch with them. Pretty much that's all I have to say, but mandatory spay and neuter is what's needed if you want to create a no-kill society. Thank you.
Thank you.
One more thing, please. If anybody would like a copy of this proposal, please give me your email address and I'll send it to you. It's 24 pages. It took me 6 months to prepare. Thank you.
Thank you, Mr. Kretsky.
Okay.
Good evening. Hi there. Just name and address for the record, please. Thank you.
Hi, my name's Nikki Kenyon. I live at 306 South 19th Street, Fort Pierce, Florida.
Good evening.
And thank you for your proposal for the no-kill. And I'm going to tell you about public relations and community development. Increasing adoptions, maximizing donations, recruiting volunteers, and partnering with community agencies comes down to increasing the shelter's public exposure. And that means consistent marketing and public relations. Public relations and marketing are the foundation of a shelter's activity and success. And volunteers are a dedicated army of compassion, as you've heard other people talk about volunteers, and the backbone of a successful no-kill effort. There's never enough staff, never enough dollars to hire more staff, and always more needs than paid human resources, and that is where volunteers make the difference between success and failure, and for the animals, life and death. And I also foster kittens. Thank you.
Wonderful. Thank you.
First of all, I'd like to say thank you very much. My name is Susan Hargreaves, and I'm the Executive Director of the Spay-Neuter Alliance of the Treasure Coast. And last year we gave out $37,000 in grants to local organizations in Saint Lucie County and in Martin County to cover free or very low-cost spay-neuter. And it's a pleasure to come here tonight to speak with you. I'm Susan Hargreaves. I live in Jupiter, but our programs for the Spay-Neuter Alliance is all around the Treasure Coast. I wear a couple of hats. And a word that I heard again and again tonight with the very dedicated lady from the homeless organization is prevention. Same with Representative Lee, prevention. And that's exactly what spay-neuter is, prevention. If there was 8 dogs in every home in the United States, if I were the queen of the world and you went home, you had 8 dogs, there wouldn't be enough homes for the dogs that exist right now. So spay-neuter is actually the only answer to stopping the problems that we have now. And of course it has increased because of the foreclosures and so on. So prevention is really important. And I just became a citizen last year, an American citizen, and I am still continually impressed when I go to local commission meetings at the respect that the commissioners show the people who come and speak, and how you react to the community, and how you're obviously involved in helping in all levels in the community. So I lived in Canada for quite some time, and in Toronto they're very apathetic because nobody votes them out, and the Canadians are a little too polite to actually do anything. Not to say the Americans aren't polite, but you're a lot more forward, let's say. And I see the results of the Americans being so forward in your reactions to the people that you are so responsive. And so I'm really impressed as I sat here tonight how everyone is with each other. So I want to thank you very much for that. And another hat I wear, which is also to do with prevention, is Animal Hero Kids. And I give awards to kids who have helped animals. And humane education, Representative Lee mentioned about dog fighting, and I have a free video that has Justin Bieber, Ron Artest, they're speaking about how young kids can be heroes to animals. So I brought enough cards for everyone there. So if I could give it to you. And all the presentations are free, and everywhere I give a presentation, they get the video against dog fighting and about helping all animals, including wildlife. So I want to thank you so much. It's been a pleasure to sit here tonight and to be a part of your meeting, and good for you for helping so many, two-legged and four-legged. Thank you.
Thank you, Ms. Hargreaves. Good evening.
Good evening. My name is John Neprud. I'm from 422 North 6th Street. I've been a resident there for over 20 years now, or about 20 years. Anyway, I'm also a snowbird, so I go away in the summertime for a few months each year. And when I bought my house, it was the hood, you know, but anyway, it's an old house with a crawl space under it, and when I bought it, it had cats living under it, feral cats. And I took the house from being 2 days from condemned up to a place I've been living in ever since, and it's nice. And the cats, you know, they were breeding and all that, and you just have more and more. As the neighborhood started to improve and they tore houses down and people fixed up houses and put up fences and got dogs, before you knew it, I had about 47 cats around 15 years ago. And I started gardening and got worms from the cats, because I guess a lot of them in St. Lucie County have these worms. I got rid of that, but eventually I decided, well, I can't have all these cats because I can't deal with that. So I kept the friendlies, and I got some friends to help spay and neuter them. And some I used to take out to the groves and stuff like that, because I know the groves had a need for cats at one point because you know, the grain and things like that, and they keep down the rat population and all. But about 3 years ago, finally, the last of my cats had passed on, and I was blessed with no cats, so I'm thinking, well, that's nice. But of course, I came back this year, we found another family of cats under the house. We're feral, so in other words, you know, if you could kill them all off, there's still going to be more cats to come and fill the spaces. That's something I've recently learned from Sharon Cooper, who has been helping me fix some cats now, which I've got, what, 4 fixed now out of 6 that are there. So hopefully that'll cut things down. But I think it's a really important program. And she had given me some literature that I'd read on about Jacksonville had implemented a program a couple of years ago doing that, and they say that their kills are down 60% in that area now. So I just wanted to let you all know that. I think it's very important.
Thank you for your time. Appreciate it.
Thanks.
Okay, we're still under general public comment.
Good evening again. It's Sally Ann Berquist. I live at 9 Del Prado Street in Port St. Lucie. And I'm going to continue to the conclusion of what the no-kill equation is. We tried to have it in sequence, but things happen. I'm reading number 10, starting proactive redemptions. One of the most overlooked areas for reducing killing in animal control shelters are lost animal reclaims. Sadly, besides having pet owners fill out a lost pet report, very little effort is made in this area of shelter operations. This is unfortunate because doing so, primarily shifting from a passive to a more proactive approach, has proven to have a significant impact on life-saving and allowed shelters to return a large percentage of lost animals to their families, as well as garner more public support and backing for the shelter. A compassionate director is what really makes this equation work. And it's the final element, and most important of all, without which all other elements are thwarted. A hardworking, compassionate animal control or shelter director not content to continue killing while regurgitating tired cliches about public irresponsibility or hiding behind the myth of too many animals, not enough homes. This is also oftentimes the hardest one to demand and find. No kill is simply not achievable without rigorous implementation of these programs and services. They provide the only model that ever created no-kill communities. It is up to us in the humane movement to demand them of our local shelters and to no longer settle for the excuses that shelters often put up in order to avoid implementing them. And in conclusion, I'd like to say that Manatee County is Florida's first no-kill community. It's considered a community, not a whole county, because there are other no-kill shelters involved. It becomes a community. Manatee County, number 1, they've achieved their goal. We have Tampa Hillsborough, Brevard, Broward, Miami-Dade, the municipality of Jacksonville, Duval and Leon, and I need to just underscore those that they are engaged into the process of becoming no-kill. It's not a wall switch. It doesn't happen overnight. And again, I'd like to thank Jack Southard and Tiffany Bennett. They are really doing a great job creating the Shelter Standards Review Committee. There is a better way. It can be done. And even Seminole County yesterday took the Just One Day pledge. So it's starting to kindle here in Florida, and I would like to just ask you, our wonderful commissioners, that why be at the back end of this in our state? Why not be up here in the front with the other counties becoming no-kill communities? Thank you.
Thank you. We're still under general public comment. Anyone else wishing to address the board this evening? Please feel free to do so. Good evening, Mr. Arena.
Good evening, Commissioner Maury. John Arena, Fort Pierce. The Home Depot Corporation bragged that they made $5 billion in the first quarter of 2013. Several weeks ago, I noticed a large banner in their parking lot printed in Spanish encouraging undocumented immigrants to apply for employment. What are Americans supposed to do? Twiddle their thumbs? Downtown Fort Pierce has become quite diversified. However, they still do not have a juice bar. Bill Gates recently became the richest man in the world again, taking the title away from Carlos Slim, who, by the way, is anything but slim, in Mexico. Why isn't he helping Mexicans so they don't feel like they have to cross the border into the United States to have a life? A couple of weeks ago, I noticed a very heavy-duty truck trying to get around the roundabout on A1A on South Beach. The truck was carrying a large gray box with a tiny sign on the side. So I went up close to read the word radioactive. A few months ago, I saw an emergency vehicle stuck in traffic trying to get around the same roundabout. The roundabout should be removed brick by brick to be recycled into something useful instead of something visually appealing, in my opinion. Thank you.
Thank you, Mr. Arena. Thank you. Anyone else wishing to address the board this evening? Seeing no movement, we will close general public comment. This time, I know staff is excited. We're going to turn to the consent agenda. If there are any items commissioners wish to have pulled for a separate vote or discussion, please feel free to let me know at this time.
Mr. Chairman, I'd like to add an item simply to approve my appointee for the Code Enforcement Board, that being Patrick Campion, to replace decades of service by Dr. Ingersoll from that board. It's been difficult to find a replacement of such stature, but we will try to do our best, and I would like to have approval of that during the consent agenda, please.
Okay. Is there a motion to approve the consent agenda?
Motion to approve.
Have a motion to approve the consent agenda along with the addition from Commissioner Zadowski. Is there a second?
Second.
Have a motion and a second. Any other discussion on the motion? All those in favor signify by saying aye.
Aye.
Aye. Unanimous, motion carried.
Thank you.
Okay. With that, we're going to turn to our next item, which is a public hearing for the Planning and Development Services. This is Resolution 2013-103. This is a resolution granting a major adjustment to the Avalon Beach Plan Unit Development Site Plan. Good evening, staff.
Good evening, Chairman Maury, Commission members. For the record, Diana Waite, Senior Planner, presenting staff comments for the major adjustment to Avalon Beach Site Plan. This item is a public hearing. To date, we have had no public comments received. The Avalon Beach PUD is located on North Hutchison Island on North A1A, approximately half a mile south of the Indian River County line. The PUD is a 15-acre platted subdivision with infrastructure in place and recently accepted by the county. Currently, all lots in the subdivision are under the ownership of the applicant, and the majority of those lots are undeveloped. Avalon Beach is surrounded by the 650-acre plus Avalon State Park. The only exception is one oceanfront parcel to the north that is owned by the applicant. The purpose of the proposed adjustment is to eliminate a clubhouse on the ocean side section of the PUD that was added to the project in 2006, and to add a single-family parcel lot in its place. The proposed adjustment also adds 2 dune crossovers. The adjustment would reestablish the original 38 lots that were approved in the subdivision. The dune crossovers are associated with the project's dune conservation easement, which was modified this evening as part of the board's consent agenda. Staff's review has determined that the proposed changes to the Avalon Beach Final Plan Development Site Plan are in substantial conformity with the original approval as required in Land Development Section 110205F, and recommend the board approve the proposed major adjustment to the Avalon Beach project. That concludes my presentation. I'll be glad to answer any questions.
Thank you. Are there any questions for staff? Seeing no questions, this is a public hearing. Anyone wishing to address the board, please do so at this time. And as always, please provide your name and address for the record. Good evening, Mr. Dobbins.
Good evening. For the record, Lee Dobbins with the Dean Mead Law Firm, here representing the applicant. I also have with me Joe Schulke with Schulke, Bildel, and Stoddard. He's the engineer for the project. And I also have here with me Joe Cooley with the applicant. Don't have any presentation for you today. It's a pretty simple amendment to the site plan, so we're just here to answer any questions you may have.
Thank you. Question by Commissioner Zadowski.
Mr. Dobbins, when y'all were in my office last week sharing the information about this project, I had approached you about, of course, the conservation areas and what you were doing to enhance those, but also the dune crossings. In St. Lucie County, we have a serious issue with beach erosion and so on and so forth. This beach isn't as eroded as the south side of the county. However, the citizens of St. Lucie County have been very challenged with the idea of putting more structures on the beach side and having erosion control, having to pay for additional cost of beach sand and so on and so forth, and protection of dunes. Have you thought about my suggestion that you set aside, your plan set aside the maintenance process by which the dunes will be maintained by the community that your client is going to build, if approved, and as well as if any renourishment needs to occur in that area, should there be some erosion? Again, this side of the beach seems to be very well nourished.
Right. Right. Yes, this is one of the areas in the county where the beach is actually growing as opposed to being eroded. And I did look at that issue after we spoke. In the HOA covenants, all of the common areas are are the responsibility of the HOA. So the HOA is responsible for the dune just as it is for any of the other common areas. To the extent that the dune needed to be, let's say there was a hurricane and the dune got pushed back into people's yards or something like that. That's something that the association would have to deal with. Does that answer your question?
I guess so, but I just want to clarify, for the record, that in your environmental plan moving forward, that it consists of making sure that the community will take care of the dune, maintain it, proper plannings when necessary, right. And should there be beach renourishment that needs to happen along your area of the beach. Mm-hmm. Again, highly doubtful that the north side is going to happen, but I'd like to treat both the north and south side of St. Lucie County's beaches the same, because I argue the same position with areas in the south, mm-hmm. That if somebody chooses to build along the beach area, that they take responsibility for making that step or taking that step.
Right, right. Well, there's nothing, there's nothing in the HOA covenants that directly redresses, beach renourishment or even dune restoration, but it is a common area. So, again, to the extent that something needed to be done, that would be up to the association.
Isn't it normally covered? I mean, this is a DEP issue, is it not? And so the DEP deals with anything that's east of the coastal construction line. I know that they often deal with any of the plantings that occur within that actual dune. They can't just go and put whatever they want in that area, even aside from county staff. They have to deal with the permitting process. And then should it be destroyed through a hurricane, they have to rebuild the dune, but not necessarily the beach as it relates to the beach restoration. But they do have to re-provide their dune back to the height, minimum height that was established by the DEP. So whatever 17 feet or whatever that point is, they have to have it developed to that.
I guess the reason why I'm questioning it, Mr. Chairman, is we've recently had to undergo a MSBU process for those to the south. My goal is to make sure that we approach, whether it be north or south, with the same concerns to taxpayers and those who would be affected by any kind of erosion. I had been asking, Diana, did you have any chance to look into some of that? And from environmental side, I thought that I had recognized a portion that was somewhere designated, that maintenance, and they were taking responsibility of that somewhere. I just want to memorialize that if it's possible.
Yes, sir. This is I spoke to the Environmental Resources Department. There is a preserve area management plan, but the details on what would be required as far as if it was destroyed, I would like to defer to Ms. Mott.
And Mr. Chairman, Commissioner Zadowski, Chapter 6, 60201F actually requires dune renourishment should the height of the dune fall below 8 feet. And so there is something in the code that requires that currently. And Amy Mott Griffin is here.
Oh, excuse me, Amy.
It's been a few years now. Amy Griffin, for the record. Thank you, Commissioners.
Everybody has it pretty well right. There's a number of fail-safes in this situation. We have the Preserve Area Management Plan that says how the natural areas are supposed to be maintained, exotic removals, replanting with native, and then there's the code, 60201, which Ms. Leslie referred to. It talks about the height of the dune and that it needs to be restored back to resemble the characteristics of pre-existing impacts. We have a number of ways to go at it, but there's definitely, you can be assured that if a dune is impacted, whether it's just exotic or any kind of vegetation removal, or if it's completely wiped out, they need to rebuild it back up and or replant. I just want to mention that prior commissions have in the past gone above the minimum code requirements, and they've set a condition on projects. That's a commission initiated thing. It's not in code, but they have required a condition of approval to be an escrow account to be put in place so that there's a funding mechanism so that the HOA has the money to actually go in and restore these dunes afterwards, after any impacts. We're not recommending that at this point. It's just something that has been done in the past by prior commissions.
And that's actually kind of what I was referring to, because the one property that we recently approved to take from commercial to residential on the south side, we did require that in as a condition. And again, this is about not just, we want to be able to support, I want to be able to support this, but I also want to protect the taxpayer of St. Lucie County for the cost if someone is going to take a step to know and understand that there are conditions that may occur. Again, the North Beach is probably not the beach it will happen to, but I prefer to treat whether it be the North Beach or South Beach or any area that could erode, any storm that could come through there, or tsunami, whatever the case. Who expected two hurricanes within 3 weeks to the day? So we don't know what's going to happen. I just want to be able to protect the taxpayers, and so that those folks who are buying in that community understand that they'll be responsible for that. That's what I'm trying to accomplish today.
But what I want to make sure I understand, because that does not include beach restoration. That was the dune itself specific. is my understanding, because we are not able to go and require an HOA to reestablish the beach, which was the case with South Beach. There was actual beach restoration that occurred, as well as there were some minor dune impacts. But it's one that, should the dune be impacted, I guess that's the question I have. And I don't know, maybe the debatable point is how wide is the actual point of the dune, because I know, depending upon which coastal construction line date you're working from, which I think the last one is, what, 1988? You look at the 78 maps and it's way out, then you look at the 88 maps and it's way in, and I know it fluctuates quite a bit. But I want to make sure I'm clear in terms of that aspect, and maybe that's a question for Amy Griffin on that.
And as she's coming up, I just, again, to point to the MSBU that we recently had partnerships to which we were able to achieve and assisting those homeowners to protect their properties for having made that decision to build on the beach. They are stepping to the plate today and assisting and making sure that that protection is still there. And I know that Commissioner Hutchinson's our area expert on erosion, so
I think we need to, and I appreciate your comment, but I think what we need to keep in mind is the fact that in this situation, I'm like you, Commissioner Mowry, there's the dune area that becomes part of the homeowners. What's on the east side of that dune then falls under state and federal regulations, of which they are not ownership. They have no ownership, so I'm a little leery of, I don't know where you're heading with what you're asking, although I know you're concerned. That's how we did the MSBU. The portions, the benefit was, and if you go back in history down on South Hutch, there was actually a lot of the dune replacement they paid themselves on for the actual dune after the hurricanes, meaning the residents did. Not as we came in with the emergency to backfill on the state and federal lands.
And Ocean Village paid over $1 million just to redo their dune that went into the pool. So that might get a question again for
To simplify one question that was asked, it is clearly defined in the planning process where exactly the dune is, the western toe, the eastern toe. It's not based on the coastal construction line, and it's not determined as we go. It's on a plan, on a survey that shows the eastern toe, western toe. This is the dune, and that's the dune preservation zone, and that is what the code is applied to, the St. Lucie County Land Development Code that requires the dune restoration and the dune replanting. So this does not get into down eastward of the dune into the beach.
Great, thank you. Any other follow-up questions or comments, Mr. Dobbins?
If I could just add, as far as beach renourishment goes, it's pretty easy here. I mean, it's not going to be an issue with this site unless something changes drastically in the future, because this beach is growing. And as far as either beach renourishment or reestablishing the dune, it wouldn't be the county's responsibility to do that.
And that's what I'm asking for, just as a commitment from you with this development, so that I can provide a affirmative vote, whether it be in your HOA documents as part of a condition of this approval, that the developer actually memorialize that, so that when if something should change. And again, that's the largest beach, and as you say, it is growing. But we don't know what's happening weather-wise, and so I'm just trying to forego something in the future, instead of having to go through an MSBU process and having to encourage members of that community to participate. I would like it to be something that we acknowledge today, going forward, and then each of the homeowners that are going to build there will understand that they're going to participate.
Well, it is an HOA common area, which is the HOA's responsibility, and of course the HOA is governed by your code, so they're responsible to do whatever's required by your code.
But again, that would apply to the dune, not to the beach. So if renourishment did occur, that actually that would not be a private association's issue.
Beach renourishment is neither a county responsibility nor an HOA responsibility. In cases where beach renourishment is done, it's either the county decides that they want to do the renourishment, or in other cases, the property owners may decide that they want to pay for renourishment, but it's not either party's responsibility.
However, as again, we just went through this, and we had to encourage a vote and go to a vote to get the property owners to participate in an MSBU to assist the county in protecting their real property, the condominiums along that beach. So, you are intending to build 4 homes on the actual beach side and
6 homes on the beach side.
6 homes on the east side. So, should there be a necessity in the future to protect those 6 homes, my concern is putting on the taxpayers of St. Lucie County rather than the persons who choose to build, on the beach. Now, I believe that, everybody should have their property rights, and I think that you have them here, but I also think that responsibility is important for those who choose to build and have a wonderful view, but also should something occur.
To help the issue then, do we not as a county have the ability through code enforcement as well as other actions to enforce, to make sure that the dune is restored? If it's not, then it becomes the process that the county pursues as it relates to the recovery of those costs. So I don't think this is an issue that will not be handled appropriately as it currently stands today.
The answer to your question, Commissioner Mowry, is yes. We have the code enforcement action. We have the code to enforce the code as it stands today to require restoration of the dune, if it comes to that, the dune.
Okay, thank you. All right, any other comments from your team? Anyone else we should address the board at this time? This is a public hearing. Seeing no movement. Remaining comments?
No further comments.
Okay, thank you. Return to the board. Commissioners, how would you like to proceed at this time?
Mr. Chairman, I'll move approval, but I would just like to reassure Commissioner Sadowski, to my knowledge, historically, in the 56 years I've lived here, I have never seen the county go do a beach renourishment program in front of any privately owned property. The only 2 that we've ever done has been the North Jetty, which is a federal program brought on by the inlet, and the second one was in conjunction with the owners at their request in MSBU, that they came to the table and started paying, and our portion that we put was on public property and public benefit. So I'm quite certain that this board and boards in the future will not be renourishing private property.
Have a motion for that. Is there a second?
Second the motion.
It's been motion second. And I would say from a discussion standpoint, I'm glad that we are having these discussions, because I feel like that's what makes us strong, is making sure that we are discussing these items and making sure that we understand from a staff perspective as well as from applicant perspective the history, what's going on, and how to move forward with these issues so we do the right thing for the county. Discussions?
Yeah, discussion. Thank you, Mr. Chairman. I would like to support this, and as I said in the office, I want to support this, but I just was looking for the reassurance, and I felt that you were going there, but without that, I'll be not approving tonight. But if you were able to have that assurance to assist or have it memorialized, I would be able to give an affirmative to this. I just think it's important that we begin thinking that way as a government agency, and try and minimize issues in the future.
Any other discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Aye. Those opposed?
Aye.
Let the record reflect 4 ayes and 1 nay. With that, that item passes. That concludes our public hearing portion of the meeting. We'll return to our regular agenda, which we have no items scheduled at this time. We'll turn to the announcement portion. We welcome our county administrator. Do you have any comments this evening?
No, sir.
Oh, wait, that sounded like you had something. I saw you thinking. You have something really quick, I could tell. No? County attorney?
No, sir.
No? Okay. Anything else for the good of the order? There will be an informal meeting on June the 11th. That'll be taking place here at the county building. And then we'll be having our strategic planning session from June the 12th through the 14th at the Havert Fenn Center on Virginia.
Mr. Chairman, the informal is going to be June 12th. It was initially going to be the 11th, but it is the 12th.
No, I said June 12th through the 14th.
Okay.
Did I say something different?
Yeah.
Maybe I did. June the 12th. I want to be clear on that, through the 14th. Right?
June the 12th for the informal strategic, through the 12th through the 14th.
Okay, I see our announcement section says
Yes.
June the 11th,
Yes.
but that's June the 12th. Thank you for the correction. I thought I was saying the strategic incorrectly. Okay. With that, any other announcements? Thank you all. Long night in terms of the public comment portion. But thank you all. With that, we will look for a motion to adjourn.
Motion to adjourn.
We are adjourned.